1st December is observed as World AIDS Day. UNAIDS hailed extraordinary progress in the fight against HIV and AIDS over the past 15 years, insisting the world has a chance of meeting the UN goal of eliminating AIDS as a global health threat by 2030. It further said that India, China and Pakistan are among the first countries in Asia-Pacific region that account for 98% youngsters aged between 10 to 19 afflicted with HIV. These regions are facing a hidden epidemic of HIV among adolescents who numbered 220,000 in 2014. Now, what are the challenges in India? Are the policies of the government adequately implemented? And what more needs to be done to say final goodbye to AIDS? And what about women who are HIV positive? Do they suffer even more in addition to social ostracization? From being economically weak to looking after families to getting themselves treated, all becomes an uphill task. So what can be done? Let's try and find out in this 1 hour. Welcome to Gender Discourse. I'm Lotty, Alaric. To take this discussion forward, I have in the studio a distinguished panel of guests, and I'm very happy to have with me Director Professor Dr. Sunila Garg, Community Medicine from Maulana Azad Medical College. I welcome you to the show. Sitting next to her is Dr. Upasana Agarwal, who's a Senior Specialist in Internal Medicine and also is in charge of ART Center at NITRD, New Delhi. I welcome you. And I have with me a very special guest today. She is Bhagwati Devi. She's living with HIV and is also a counselor at this ART Center and doing a phenomenal job at that. Welcome. And I have with me to my left Dr. Madhu Sharma, who's a project officer mainstreaming from NACO. Thanks for being here. Well, first, Dr. Sunila Garg, I'd like to say that she is also the coordinator for postgraduate fellowships in HIV medicine. So it's very right that we have you with us today, Dr. Sunila.
Thank you.
So let me just begin with you, Sunila, that can you just tell us as to what was the condition, say, a few years down the line, if we can compare, and where do we stand today as far as HIV positive patients go?
Looking at the figures, you rightly pointed out that, you know, when I used to talk about HIV/AIDS problem in 2005, 6 and all that, they were all guesstimates. We were talking in terms of numbers.
Correct.
That means I spoke in one forum from 5.2 million number of cases. Now it has gradually come down, and I was discussing today with my own colleagues and all that. It is now currently 17 lakhs, or in terms of million,
right.
It is 2.1 million cases.
2.1 million, that's
okay.
Right.
So, it will not, I'll not say that possibly it is only the numbers which have declined. It is also the guesstimates which were earlier there have also been revised. But nonetheless, you know, we must give all the credits to the different interventions which the government has brought out.
Right.
In terms of, you know, opening up new ART centers, or in terms of prevention of new infections, in terms of increasing our reach for integrated counseling and testing centers, improving access of people to, you know, care and treatment, and also, you know, it is a multi-sectoral kind of a strategy which is working, because one size will not fit all. So that is where we need to look at, that we increase our focus with the, in context of education department, Ministry of Railways is involved in a big way. So, you know, like Dr. Madhu is there,
which means it has been a multi-pronged approach.
Yeah,
actually.
And especially you see the areas which still need much more attention are, you know, from the perspective of gender. I'll say the women still, you know, need to be addressed more and more, because HIV positive woman, unless she is brought into the formal gamut of healthcare delivery, she will be delivering, you know, wherever she likes to, but our focus is she should be delivering in an institution,
yes.
so that, you know, she can undergo testing, and if she is positive, she receives the appropriate kind of treatment, which we'll be discussing when
yes, absolutely,
later
absolutely. Yeah, so Dr. Upasana, would you want to add anything to this, because you've also been working in this field for a very long time now?
Well, Lottie, what I would like to add to this is that is very true that there was some revision of the estimates, but yes, when we revised those estimates, then too it was said that we have about 2.5 or 6 million people, and now the figure has actually come down to 2.1.
Yes.
So that I would say is a major achievement. But what we have to understand here about HIV is that, see, HIV as an epidemic has 3 or 4 waves. The first wave is that it will be only found in people who are high risk groups, like maybe the commercial sex workers, IV drug users, and the so-called other high risk groups. From there, it would come to the men who are living in normal families, in regular families, who are not otherwise considered high risk groups.
Correct.
And the third is from these men, from these domestic people, it comes to the women. So we as a country are now in the third wave of the epidemic, and this is known as the feminization of the epidemic. So now you see, we are in a stage where the epidemic has got feminized. It is no longer a problem only of the high risk groups. And if you would see the rough estimate, out of all the HIV positives in our country, about 40% are women and 4% are children, approximately.
Right.
So that's an issue of concern.
Right. Now, Dr. Madhu, like the numbers have come down, which is really good news. But were you all expecting the numbers to come up till here, or were your hopes higher than this?
Yes, we were hoping, that numbers will come down expectedly, but they have been coming down as a result of, our strategic approach to prevention, to provide care, support and treatment, and to link people living in the HIV with the social protection schemes, so that the quality of their life improves. And India has been lucky that we made a strategic start right from the beginning when the infection was first diagnosed in 1986.
Correct.
And NACO was set up immediately, and then we had a phased program. Now we are in the 4th phase of the program. So in the initial years, there was generalized awareness among India, and we had few these things. And in the second phase, we decentralized the program to state level and district, and we now also have 189 district units. So we strategically moved from prevention, and we started ART in 2004. And we've also started second line ART in 2007 and third line ART since 2012. It is yet to be rolled out. So nearly 9 lakh people are on ART. So new infections are decreasing, but people who are on living with HIV are staying longer. They are
so that means that the disease is being managed well. That's what we can say.
Yes.
Right.
The infection, which was a 0.41 in 2007, this thing 6, is now 0.26. So it's a major achievement.
It is a major
but
achievement.
With a perspective of, as the doctor said, decrease in women is not as proportionate as in the overall proportion.
That's right.
So earlier we were, 25% of total estimated people were women. Now we are 40% of estimated people are women.
Right.
So that's
राइट भगवती, अब मैं आपके पास आना चाहूँगी. अब आप काउंसलर के तौर पे काम करती हैं ART में, और जैसे डॉक्टर उपासना ने बताया कि बहुत बढ़िया काम करती हैं, तो कॉन्ग्रेचुलेशन उस बात के लिए. लेकिन अब आप मुझे बताएं कि आपको कब पता चला कि आप HIV पॉजिटिव हैं, और आपका पहला रिस्पॉन्स क्या था?
2006 में मैम मुझे सबसे पहले पता चला था कि मैं HIV पॉजिटिव हूँ. सबसे पहले मेरे हस्बैंड का पता चला था. वो काफ़ी सीरियस हो गए थे, लगभग पैरों ने तो काम करना बंद ही कर दिया था. तो इधर उधर हम इलाज करा ही रहे थे. तो 2006 में कहीं जाकर हमें पता चला कि उनको HIV है, और उनकी जब जांच हुई तो उसके 2-3 महीने बाद ही मेरी भी जांच हुई 2006 में ही. तभी मुझे पता चला. तब तक मेरे 2 बच्चे हो चुके थे.
अच्छा, और बच्चे आपके बिल्कुल ठीक हैं?
हाँ, बच्चा एक तो एक्सपायर कर गया है बेटा, और बेटी है लेकिन वो ठीक है.
तो आप क्या घबराई, डरी उस वक्त, या डॉक्टर्स ने आपको अच्छे से काउंसिल किया? आप थोड़ा सा बताएं.
एक्चुअली मैम उस वक्त जो है हम लोगों को जो पता चला था वो सफदरजंग हॉस्पिटल की बात है. उस वक्त सफदरजंग में जो है HIV एड्स का कोई ट्रीटमेंट नहीं था।
2008
में बना था वहाँ पे। तो वहाँ पे ICTC के जो काउंसलर्स थे उन्होंने ठीक से हमें काउंसलिंग नहीं किया था। HIV के बारे में मैं ठीक से जानती नहीं थी, इसलिए कोई शौक भी नहीं लगा, क्योंकि जब जानती नहीं थी, जो लोग जानते हैं उन्हीं को शौक लगता है। मुझे तो सिर्फ इतना इत्मीनान हुआ था कि हाँ, हमें एटलीस्ट कुछ पता तो चला, अब हम इलाज करा लेंगे। हमें तो ये भी नहीं पता था कि इसका इलाज है भी या नहीं, इसलिए शौक वाली तो कोई बात नहीं थी।
Right. So, Dr. Sunila, this is clear, you know, that the awareness clearly was not there as it should have been. But over the years now, what has been your experience? Do you really think people are aware even now, or people are just, you know, risky behaviors they are living with and things like that?
You see, awareness is the first thing on which the government is focusing.
Right.
But still, I'll say awareness is still not to that much extent as desired.
Correct.
Myths and misconceptions are still very common. The country is very, very diverse. And particularly if you will see from gender perspective, where women have limited opportunities, you see, because in that case, biological, socio-cultural, economical, so many aspects are there, you know.
True.
And where is the chance for women to get an access to? Because even, you know, the access to healthcare delivery points are not there. She, even if the girl child is enrolled in the school, she is not continuing with her education.
Yes.
So that's where, and also you see, more important thing which you have to keep in mind is that you see, apart from you see lack of awareness and education amongst adolescent girls, the problem is also amongst women, you see, who are around 60 years of age. They are not only positive, but they are also caregivers.
Absolutely.
So that's where, you know, kind of a thing, you know, is weighing in front of our country, and it's a big, big burden. And it's a challenge also. To reach out to the women is a challenge, because you see, every state is very diverse. The interventions which can reap fruits in southern part of India may not necessarily reap fruits in Uttar Pradesh or in Madhya Pradesh and all, because we are seeing now more cases of HIV AIDS from northeastern states as well.
Right.
So that's where is the challenge to combat the disease, and more so it's a dual challenge when you have to look out or you have to address in context of gender also. So I'll say that the program has done well per se. It's not that we are in the same state what we were there in 90s. Program is doing well, but to change behavior,
yes,
with the help of
these are very
effective
individual
awareness.
actions and choices also.
Yes.
Cannot be governed by the government.
Cannot be
of course.
governed by the government. It's the family values.
Correct.
If the woman has to deliver in the institution, it's decided by the family without knowing for the fact that she might be HIV positive.
That's right.
And you know, my experience with Northeast states also reveals, you know, basically when I went for the first launch as a WHO advisor for launching of ART treatment, what I observed was the women are quite empowered. But empowerment does not necessarily translate their knowledge into action unless they have the right access to right kind of messages and actionable points.
I agree with you completely, and Upasana, I'm sure you'd agree too, because see, in our country, even in affluent classes, you know, the moment a man sneezes, the whole family will be around him and looking after him as to what has gone wrong, and he will make sure that everybody is around. But for a woman, till she actually falls down, she faints, nobody even bothers what is going wrong with her. So what are we really talking about here? Access to health, and even being aware sometimes really does not translate into actually, you know, decisions in health. What would you say?
I totally agree with you, you know, Lotty. Actually, HIV is not a medical disease. It's a socio-economic disease. And as I said, okay, as you just pointed out, a woman might be economically empowered. But is she socially empowered?
Right.
There is a difference between an economic status and a social status. You might, as a lady, might be earning a lakh or 2 lakhs per month, but you might not be considered as the same social status as your husband or your brother-in-law or your father-in-law, who might not be even bringing the bread home, like they just might be sitting at home. So when we live in such a society, you know, this is a problem, I would say, pan-Asia problem. This is empowerment of women socially. You can educate your girls, you can give them the earning capacity, but the social status has somewhere been left behind. So when you're talking about these people, and you know, and something very disturbing is, okay, I can understand that some part of HIV occurring in commercial sex workers,
right.
But you know, most of the HIV that we see in our country, the numbers are mainly contributed, the women numbers, from women who are in supposedly monogamous marriage relationships. And interestingly, even after they know that their husband is HIV positive, they are in no position to negotiate safe sex.
Absolutely, absolutely. And they to take a decision or be affirmative, assertive about what they want.
About whether they want a condom use or not.
Yes.
They are just not able to negotiate safe sex. So when, even if you have the knowledge, you know your husband has HIV, you have been counseled in an ART center that you have to have a sexual intercourse only with a condom, they are not able to negotiate safe sex. So this sort of complicates it tremendously. It complicates the problem for women tremendously, I would say.
Right. Would you want to build on that a little, Dr. Madhu?
Yes. Women's vulnerability, as ma'am has talked about, comes from broadly three biological factors. Because of her biological construct, they are more prone or susceptible to sexually transmitted diseases, which makes them vulnerable to HIV. And across the North India, we find that very many women have sexually transmitted diseases, which they get from husbands. But in line, the stigma faced by women is far more.
Correct.
Within the house, it is the husband who is giving the infection to wife.
Yes.
And after
and
death
the
of
stigma
husband,
is faced by the woman.
The woman
mostly.
is thrown out.
Correct.
That you've given the illness to man.
Right.
So that is the one biological reason. Then economic reason, because of their poverty or economic constraints in the house, women may be forced into going to commercial sex work, which enforces their vulnerability. And NACO started interventions with targeted interventions with female sex workers. Now is running around 500 targeted interventions with female sex workers, and across the nation we've seen the infection rate in female sex worker has tremendously come down, but
which is
it is going higher in IDUs. IDUs, which was earlier limited in northeast part of country, is now spreading to Haryana, Punjab, Chandigarh and these northeast states. And the challenge is, earlier the epidemic was concentrated in high prevalence state, Tamil Nadu, Karnataka, Maharashtra and certain states. Their health systems were very well equipped. They could manage the problem.
Right.
Now it, due to migration, because men are going out for earning, bringing the infection and
back
giving
home.
it to
Yes.
wives.
Correct.
And this is traveling to northeast the northern low prevalence states. And there the health systems are not so geared up. So the infection might be going under the carpet.
I'm going to come back to you because it's time for us to slip into a break. But folks, if you're listening, I think these are very important things, that now the epidemic, almost if we can call it an epidemic, is also going to other states. Now these should be our red flag signs, and we've got to take stock of the situation and act accordingly. So do think about it. While we slip into a break, when we come back, we are going to carry this discussion forward. So just stay with us as we come back soon. Welcome back. You're watching Gender Discourse. Today we are talking about challenges that HIV positive women face. Well, Dr. Madhu was telling us as to which are the pockets in our country which are more affected, and also you were telling us about the migratory population that comes in, that this is a vulnerable population. Yes.
Yes. In certain states, it was called as, a specific Mumbai wala disease in Bihar and Odisha, because people came back from migration and gave infection to their wives, or Surat Ganjam corridor.
Okay.
So certain corridors were identified.
Right.
I mean, NACO has been very, evidence-based strategies have been adopted by NACO.
Okay.
As in when we got this data that monogamous women are getting the infection, we inquired what is the factors behind them. So we found that migration was
one of them,
one of the leading cause which is driving the epidemic. So migration strategy was adopted. We started interventions at the destination place with the men working in those labor camps and colonies in the hard cities. Then at the transit in the railways and buses and the platforms and those things, awareness was heightened. At source, with the spouses of migrants, we also started imparting information. As I said, communication and awareness is very necessary. Still in country like ours, we have 99.72% people who are not infected, and we have to keep them not infected.
Absolutely.
So that's itself a trend. So awareness generation has been a major focus, but we cannot compromise on the treatment part. Because now these people do requirement treatment. Antiretroviral treatment is a costly affair, and country is, India has a second largest publicly financed ART program in the world, and we are providing drugs not only to India but to South African countries also
as well. Right. अच्छा भगवती, मुझे आप बताएं कि अब आप काउंसिल करती हैं और लोगों को और औरतों को, तो कितना मुश्किल होता है, या इसमें स्टिग्मा कुछ अटैच्ड है? आपको लगता है कि उनको लगता है कि इसके बारे में हम बात नहीं करेंगे या इसके बारे में हम किसी को बताएंगे नहीं, तो आप ये सब बात करती हैं क्या उनसे?
हाँ जी मैम, एक्चुअली जो भी नया पेशेंट आता है तो वीमेंस के साथ एक्चुअली सबसे ज़्यादा डिस्क्रिमिनेशन है।
करेक्ट।
क्योंकि वीमेंस को नॉर्मल ज़िंदगी में भी अगर देखा जाए तो काफ़ी मुश्किलातों का सामना करना पड़ता है, और उसके साथ अगर HIV हो जाए तो सारा दोषारोपण उसी के ऊपर आ जाता है। ये चीज़ हर ज़्यादातर सभी पेशेंटों में देखा जा रहा है जो वीमेंस आ रही है, और जैसे ही उनको पता चलता है कि HIV है, अब चाहे कैसे भी आया हो, लेकिन परिवार में सबसे ज़्यादा डिस्क्रिमिनेशन है, क्योंकि परिवार वाले अधिकतर यही कहते हैं कि ये जो भी कुछ हुआ है तुम्हारी वजह से हुआ है।
तो आपको आपके परिवार में इस तरीके की कुछ दिक्कतों का सामना करना पड़ा था कभी?
हाँ जी, मेरे साथ तो डिस्क्रिमिनेशन आज तक ख़त्म ही नहीं हुआ, अभी तक भी चल रहा है, क्योंकि हस्बैंड ठीक तो हैं, दवाइयाँ लेते हैं, ठीक चल रहा है, लेकिन पहले जैसी सेहत नहीं रही, पहले जैसा का हार्ड वर्क नहीं कर पाते। अब ससुराल वाले तो यही कहते हैं ये जो भी कुछ हुआ है तुम्हारी वजह से हुआ है, इसीलिए फैमिली से अलग थलग किया हुआ है, बिल्कुल एक जैसे छोटा सा कमरा दिया हुआ है रहने के लिए। और बच्ची है मेरी जो मेरे पास, उसको भी और बच्चों की तरह मतलब प्यार नहीं मिलता है, वो बस पल बढ़ गई है, किसी भी तरीके से अकेले रहती है, किसी को कोई मतलब नहीं है। अब ये सब डिस्क्रिमिनेशन ही तो है।
Absolutely. This is really sad, in spite of all the awareness and everything that is being done by the government and its agencies. I think this is really sad. So now, Dr. Sunila, tell me, she's talking about, cities like Chandigarh, cities like Ludhiana. Now, these are cities which are very affluent. There's a lot of money, and also people are quite educated, not because there's a university in Chandigarh, you have so many colleges in both the cities. So why do you think such risky behavior is on the rise, and why do you think you're getting more patients over there?
Very, very rightly pointed out by Dr. Madhu, and I'll add on to it that these are not only affluent cities, but the affluence is also compounded by business.
Absolutely.
And where you see the male partners have to travel for a larger portion of the time, they stay away from the families, let's say for 7 days a month, or maybe much more than that. And you see these men, though they are aware of, but still, the urge makes them indulge in risky behaviors. When they come back home, they indulge again in, unprotected sex, and which brings the infection to the women.
Right.
And however, we may debate upon, the woman, when she is testing positive, she still has no right to question her husband, or, after he comes back home from the business trip and all, she is not in a position.
Correct.
And this was also, I observed this whole observation in context of my trainings with the paramilitary forces and all that, because there is a routine that our workforce remains out, and when they come back, women are not in a position to question them.
That's right.
And that's where is one of the major challenges, that it's not only the affluence, but whether the affluence really translates into meaningful action. So our empowerment lies, in terms of, or our of the women lies in terms of negotiation, which Upasana pointed out earlier, and also in terms of basically having a meaningful dialogue within the family itself. So, they may be aware of the disease, as you said that earlier also, that we also perceive that it is somebody else's problem.
Absolutely.
It is not our problem. So we have to see that not only we are economically empowered, but we are also socio-culturally empowered. That
right.
means we are
That's
able
right.
to take
Right.
decisions.
Right.
And we are able to have a meaningful dialogue within the family. And if at all something happens, we are able to access the healthcare facility.
That's right.
So we are most of the times dependent on our partners, that or the husbands who are going to take us to the healthcare facility, which creates a lot of delay, because there is also a culture of silence which is associated with the disease. So all these factors, they compound. So, it's not a question of that it's a affluent city and all that. It's a question, it's a rather problematic situation.
Absolutely. As I think Upasana said. Yes, Upasana, you want to add something?
Lottie, what I would like to add to what ma'am has said, she has said absolutely everything that she said is correct. The other thing that we see when you say affluent and educated places, like where students are there, You see, as you just read out, adolescents are at a huge risk.
Huge risk, that's right.
You see, it's not only, like, I understand education and awareness plays a part, but then it is always somebody else's problem. AIDS is always perceived that it will only happen to people who are visiting the commercial sex worker.
Right.
But if you will come to an ART center, any adolescent, any lady, any young girl who you will see, she or he would have got HIV from her so-called girlfriend or boyfriend.
Right.
So you can actually get HIV from somebody you're not even suspecting.
Absolutely.
So the thing that we have to understand here is that it is very, very true that maybe there would be a kind of personality or a kind of mental set where people would have sex with multiple people without the other partner knowing that.
Right.
But what we can promote to prevent our adolescents, which I really want to speak from this forum, is that they should understand there is something known as safe sex.
Absolutely.
Okay, so you are at that age, maybe not even age, you are migrating, you need sex, but you can have it safe. So safe sex has two components. One is not to have multiple partner sex, which means that at one time you please be in relationship with one person.
One person, right.
And second is, for every sexual contact, please use a condom. So if these two things we can inculcate in the mind of our young, of our men, of our laborers, then maybe we can bring down the sexual transmission to an extent. We can understand that maybe over a decade or maybe over a century we cannot change the sexual tendencies of people. But they can definitely do it seriously, and it is everybody's problem.
That is right.
It is everybody's problem.
Absolutely. And if a man cannot be responsible for the woman he wants to be with, then I think the girl should think twice before being with a man like that, or with a boy like that.
Girls to negotiate safe sex.
Absolutely, because you can't just stop them from doing things, but at least you can tell them to be assertive.
I think mothers should wake up and they should realize that they will have a group of girls in their house, teenagers, who they don't even know they are sexually active. So it's high time that had a talk with their daughters.
True.
That we understand you might want to have a sexual relationship. I understand that you might even go ahead without telling me, but at least please.
Absolutely, because somehow in our country, Upasana, very interestingly and very funnily, every parent thinks that this is a problem of the neighbor's kid. It cannot happen to mine. I think this is something that has to change. You know, we've got to change the way we think, because teenagers will be teenagers or adolescents will be adolescents.
So we have to start talking to our children.
But wherever you see, I think that still we cannot overlook or oversee the problem that mothers are still very reluctant to talk.
That's the problem.
And you know, that's where, you know, the schools, they came out with the ARSH program, that is Adolescent Reproductive and Sexual Health Program, where from every school 2 teachers and the principals were involved. And they also, after initial hesitation and lot of hiccups, this program, you know, has begun. And but you know, still, you know, we have to rather focus on these issues more and more, because we do have reluctant parents.
Absolutely.
You see, even if the mother or father tries to initiate a dialogue with their daughter or with their son, they kind of, you know, brush away the situation. They will say that we know everything, kind of, you know, they do not take into you know, the cognizance, the fact that it's a serious issue.
It is a serious issue.
And government also came out with a program that University Talks AIDS. So it was, you know, from the perspective of that we will initiate a dialogue at our level, knowing the mindset of our people within our own communities. Because as I am telling you, there is a rural divide, there is an urban divide. It's quite a mix of population.
And there's a gender divide.
And also you see, Dr. Madhu will agree with me that the disease has now percolated down from urban to rural areas. It is no longer a problem of urban areas, but the mindset of people in rural areas has not changed to that extent. So we have to involve all possible forums where the information can reach to the teenagers, as rightly has been pointed out by Dr. Upasana as well, that these adolescents are the ones who are very, very vulnerable. Teenage pregnancies have not gone out of the scene, despite talking that, you know, getting pregnant at 17 is very, very you know, risky for the girl child. You know.
Okay, so yes, Dr. Madhu, tell us about these programs.
Running, you know, recognizing the problems as mentioned by Dr. Sunila and his thing. NACO is running adolescent education program across the country, under which more than 50,000 schools are being covered, where teachers are trained, and you know, directly this 9th and 11th class, there's a syllabus on, you know, life skill programs, how to have safe sex and how to go about making decisions and negotiating for the safe sex. But few state governments are not agreeing to it. But across the country, number of states have taken action to implement that adolescent program. Similarly, in colleges, we are having red ribbon clubs.
Okay.
To spread awareness about HIV, to make them aware about the benefits of voluntary blood donation and how to maintain the safe sexual relationships.
Right.
And we do have around 4,000 red ribbon clubs across the country. And we have also, because the issue is so multi-sectoral, as ma'am said, we are negotiating and partnering with various ministries, because it's not only health ministry's job.
Absolutely, I agree.
And we started initiating our partnership with 31 ministries. 14 ministries have come out and signed an MOU with us, and they are trying to take the issue to their own workers, because informal workers, the women workers, the contractual workers, they are highly vulnerable. So they are also integrating HIV into their own trainings. They are also integrating HIV into their own medical services if they have. So many ministries are taking very, very proactive steps.
Because that's how we'll be able to actually achieve our targets. That's right. That's right. Well, we'll have to slip into a short break right now, but I want you to take this seriously. So girls and women, if you are watching, be careful as with the kind of men or boys that you get close with, because if these people do not respect you, then I don't think that's the man or the boy that you should actually be with. So do think about it. And we are going into a short break, but we are coming back very quickly. You come back too. Welcome back. You're watching Gender Discourse, and today we are talking about challenges that HIV positive women face. भगवती, अब आप मुझे ये बताएं कि आप 9 साल से शायद HIV पॉजिटिव हैं, है ना? ऑलमोस्ट 9 साल से। तो अब आप जाहिर है कि आप दवाओं पर हैं, तो आपकी जो क्वालिटी ऑफ लाइफ है, क्या वो सेम है या आपको कहीं कुछ कमी लगती है?
कमी तो मैम नहीं है। पहले क्योंकि मेरा तो मानना ऐसा है कि HIV के साथ भी मैं जी सकती हूँ।
Absolutely.
और जी ही रही हूँ। शायद पहले भी ऐसा ही होता, बट डिस्क्रिमिनेशन तो है।
जो डिस्क्रिमिनेशन जो है वो आपको तकलीफ देती है, लेकिन आपको वैसे कोई तकलीफ नहीं है कुछ भी काम करने में।
वैसे कोई तकलीफ नहीं है।
और आप दिखती भी माशाल्लाह बहुत खूबसूरत है। तो इसका मतलब सब ठीक है।
Yes.
Good. So this is the message that has to go around to people, that you can live happily even if you are HIV positive, provided you have a mindset like Bhagwati's. Okay, now Sunila, tell me about the drug users, injectable drug users. Now this is something that earlier I believe was people thought that only the boys are doing it or the men are doing it. But is it also, that is also changing, is that scene also changing somewhere? And how risky behavior is, how at risk are these people?
You rightly pointed out that basically the presumption was that only boys are indulging into it.
Right.
But all along the way, as I said, my first experience with Manipur was there, where I saw both boys and girls.
Okay.
Even in college scenarios, the girls are not surface or they are not documented, but gradually, as the evidence shows, it is both boys as well as girls. And particularly, when we are seeing the newer cities, earlier, when I used to look at only Manipur figures, there were 70% of the adolescents who were HIV positive, but the interventions brought out through NACO and other NGOs and all have really brought down the incidence or the newer cases of HIV amongst injectable drug users. But only thing what we have to remember is that these both boys and girls who are indulging in IV drug abuse are also indulging in other risky behaviors. That means they are indulging in unprotected sex as well.
Right.
So that is where, which makes the problem even more complex. And this risky behavior, that means is definitely unprotected sex, and starts right from the teens as well. So the access to drug is not only that it is one is accessing just from the families of middle class and all, it's also the children from the affluent class. So even they are going to college for learning and for education and all that, but simultaneously whether you take into cognizance the medical institutions or other professional institutions or the routine colleges, it has become a kind of an overall problem as well. So this is where you see we need to be very, very proactive, that we do not only talk of safe needle syringes or needle exchange projects and all that, but we have to have a multi-pronged kind of a strategy where we address the whole issue in totality. But first important thing which I will say is that you do not start blaming them. Absolutely. You have to come to terms with the behavior.
That's right.
Then only you will be able to bring them into the gamut of our healthcare delivery or into the gamut of our awareness programs. So, you know, when earlier we were talking about, initially I remember when we started talking of needle exchange projects and all that, that means, you know, wherever the youths are indulging in or anybody is indulging in IV drug abuse. So, there, you know, we went with safe needle and syringes and all that, and so that, you know, the person who is using that needle and syringe, he disposes that needle and syringe in the, you know, antiseptic solution, and then simultaneously he takes new set of needle and syringe. So, idea is that, you know, whatever you are doing the sharing part, but you do not give the infection to the others. Simultaneously, there were packets of condoms which are kept, you know, and people pick up, and there are other people also who are not indulging in unsafe behaviors, but they also pick up. No question asked, no question given. But, you know, when we initiated a dialogue, as I said in the beginning, people were of the opinion that this kind of a strategy is going to promote more risky behavior. But if we have to make a dent, whether it is with regard to IDUs, whether it is with regard to alcoholism, whether it is with regard to smoking, because adolescent of today is indulging in multiple things, which has got to be addressed in totality. So, most important is that we come to terms with the behavior, we make our intervention very, very strategic, and, you know, then we start doing our deliverables. So, that is where we have to be, you know, very focused in our interventions.
Right. Yeah, before I come to you, Upasana, very quickly, can you tell me if there is a person who is HIV positive and is also a patient of tuberculosis, then what happens?
See, tuberculosis is the major killer of people with HIV. About 50 to 60% with HIV will get tuberculosis somewhere down the line. Either in the beginning they will be diagnosed because of this, or maybe later they would acquire, because the lifetime risk for getting TB in HIV positives is always high because they're immunocompromised HIV positives. So, if you have HIV and you have TB, the condition of the patient is of course very bad, because both diseases alone can cause a considerable amount of sickness and illness, and when it is 2 plus 2, it is actually 5, not 4.
That's right.
So, it is very, it becomes a very difficult case to manage, but then not to be disheartened. This patient would need both anti-TB treatment, both anti-retroviral treatment for HIV, and thankfully the government of India gives both treatments free of cost. So, we have, I think now over the past 10 years, treated more than 500 to 600 patients who had HIV and TB, and they got free treatment from the government, and most of them are doing very well. They are living healthy lives.
Great. Also, I would want you to take this opportunity of, you know, just highlighting the symptoms that if a person does get HIV positive, then what are the bodily changes that he or she should expect?
See, the most important thing that we have to understand about HIV is that for the first 7 to 8 years, it will be silent. When you get the virus inside your body, for the next 7 years, maybe you will not even know that you are harboring HIV. You will be like a normal person. You will, maybe you get some minor colds and coughs, some boil occasionally, or some minor problems that you, HIV positives, HIV negatives, anybody can get.
Yes.
But then what happens, the immunity that the virus was breaking down over the years comes to a level when it can no longer sustain a healthy body. So now with this low immunity, you will start developing serious infections. And the symptoms of HIV are actually the symptoms of the infections that you get. As you get TB more, so usually what do people of HIV in India present with? They present with cough, they present with fever, they present with diarrhea, they present with weight loss, they present with multiple boils, ulcers, herpes, a very serious form of herpes, fungal infections. So this is usually what they present to us with.
Right. All right. So, Dr. Madhu, now tell us as to how should these people manage their condition, manage their disease, and as she said, the program is free of cost, but do people have access to those centers?
Yes. India has started antiretroviral treatment program in 2004. Now we nearly have 9 lakh people who are getting this treatment across antiretroviral treatment centers across the country in all district level hospitals. Then we have because people were finding it difficult to come and take that medicine every month, and travel support was required, we also negotiated with state governments and central government to provide travel support wherever needed, and also take our ART centers nearer to the patient.
Correct.
So we started the strategy of link ART centers. Where initial investigation can be done at the ART center, and thereafter you can take your medicine from link ART center, which is near to you.
Correct.
So we have nearly 900.
So that must have come in handy for a lot of people.
Yes, yes. And we have people for more than 20 years who are surviving on ART happily and productively. So that is certainly helping a lot. And we are also linking them to social protection schemes for their livelihood, for widow pensionhood, for their basic identification and all, because these are the factors which make them vulnerable to HIV, because people get into sex work because of their compulsion, because of the economics. So we are also addressing it. Another factor which is which is the cause for transmission of HIV is that HIV can get transmitted from pregnant mother to child. So India is providing free treatment to all pregnant mother, free testing and treatment. And if a mother takes on antiretroviral treatment right from 14-week early registration as far as possible, the chances of baby getting the HIV is very remote. It has come down from 25% to less than 5% now.
Right.
And we are aiming for zero new infection among
by 2030.
Eliminating PPTCT from by 2030.
Right. Okay.
But among children we are aiming for 2020, but overall ending AIDS by 2030 is the same, through 90-90-90 strategy, which means that 90% of estimated people living with HIV know their status, and 90% of them are on treatment, and 90% of them have a suppressed viral load, means healthy life.
Right. So, Dr. Sunila, finally, what would you like to say about the quality of life that these people can have even if they are HIV positive?
I'll say that the quality of life, when the person is not only accessing ART treatment, but is accessing counseling services regularly, and with the help of that he is into I'll say he's very active, he's complying with balanced diet, he's complying with exercises, yoga, meditation. It's overall a comprehensive thing. But most important is that he must access the treatment regularly. Not that he has sought the treatment today and he feels symptomatically is better and he gives away. So adherence is one of the very big issues which needs to be focused upon. As Dr. Madhu already pointed out, that we are aiming at that by 2030, not only the persons have got to be on treatment, but they have to be they have to be, their levels have got to come down. They have to be basically viral load has to come down.
That's right.
So that is one thing from the medical perspective. But as far as the other perspectives are concerned of quality of life, there are different domains: physical domain, mental domain, psychological domain, interpersonal domains. All these domains are going to be taken care of when the families are involved.
Absolutely.
It's the person cannot do a job alone, HIV positive, if the families are not supportive or not even they are not educated. First support comes from the family, and then comes from the community, and then comes from the other kind of related
components
individuals or people at the workplace. So that is where we need to provide educational package to everyone, clearing their myths and misconceptions. We rather enable them to have HIV positive individuals to have a positive quality of life, which I mentioned in terms of all the domains. So that is where he is going to live a healthy life. And she already said that there are people, Dr. Upasana said that there are people who are there for more than 20 years on treatment.
That's right.
And they are living. And she also pointed out that, she is on treatment for more than 9 years or so. And, though it's a kind of an individual perception, but you see, one leads to another thing.
Absolutely.
So that's where, it's a kind of approach which we have to adopt, and we have to take everybody into
together. Absolutely. Yes, Dr. Upasana, what are going to be your final comments?
So my final comments is that the best thing is prevention. For prevention, we would not wish even one more person to become HIV positive. So prevention, number one, safe sex, that is no multiple partner sex, and every sexual encounter with a condom. all HIV positive mothers, all pregnant mothers, please get yourself tested for HIV.
Right.
In case you're HIV positive, so that treatment can be started early and your child and you can be safe. Third, never get injections from any local practitioner or somebody who uses syringes again and again,
Right.
who uses to give you injection by dirty syringes. If taking IV drug use, break the habit. If you cannot break the habit while you are still trying to break the habit, at least use disposable syringes. And the fifth message I would say, it is a very, very big practice in our country कि थोड़ी सी कमजोरी हुई and blood चढ़वा लो आसपास. Please do not get blood transfusions from rural places where it is not tested for HIV, like in all government and major institutions of the country. Please avoid blood transfusions. A blood transfusion cannot give you strength overnight, but yes, it can give you HIV overnight.
Absolutely, and for all your life.
And second, and the only thing,
Yes.
please get yourself tested for HIV. HIV is not somebody else's problem. As I said, 7 to 8 years, it will lie in your virus, it will lie in your body, you will not even know from where you got it, and by the time you get it, a lot of time, a healing time would have been lost. You need to get yourself tested. There are ICTC centers. These are free HIV testing centers where a person without a doctor's advice can walk in and say, I want a HIV test. And his testing, his result, everything will be confidential. If you are not positive, thank God, do not indulge in risky behavior. If you are positive, don't worry. There are free HIV clinics all over the country which are called ART centers, where you will be given medicine, social support, and whatever support you need, we are there to help you. So it's a bright future, but prevention has to take place.
Absolutely. Yes, भगवती, अब आप क्या कहना चाहेंगी जो लोग आज आपको सुन रहे हैं?
हाँ जी, सब मेरा लोगों से तो यही कहना है कि हर HIV पॉजिटिव व्यक्ति के लिए काम होना बहुत ज़रूरी है, क्योंकि अगर हमारे पास काम होगा तो हमारा क्वालिटी ऑफ लाइफ में काफ़ी चेंजेस हो जाता है, ऑटोमेटिकली कॉन्फिडेंस लेवल बढ़ जाता है। और इसके लिए मैं सबसे ज़्यादा डॉक्टर उपासना को थैंक्स कहूँगी, क्योंकि मुझे उन्होंने एक मौका दिया कि मैं पॉजिटिव लोगों के साथ काम कर पा रही हूँ, क्योंकि एक पॉजिटिव का पॉजिटिव से बात करना एक बहुत बड़ा मैसेज होता है।
एब्सोल्युटली,
ये एक बहुत बड़ा पॉजिटिव पॉइंट है जो शायद मैं एनजीओ लाइन में रह करके नहीं पूरा कर पा रही थी, बट वो एम मेरा यहाँ पे पूरा हो पा रहा है। तो काम इज जरूरी है।
Absolutely, absolutely. On that note, I'd like to say thank you to all four of you for coming today and for talking about this issue. Well, friends, as everybody here has been saying, that the key to empowering women is to provide them with education, ensure that they have economic opportunities, as Bhagavati said, and that they control their income and resources, reduce violence against women, and enable them to participate in decision-making at all levels of society. They should be strong enough so as not to let any man abuse their bodies. HIV/AIDS can be a huge price to pay. But the fact that India's HIV infection rates are lower than originally estimated is wonderful news. But it does not mean that women no longer are at a risk of HIV or that women's lives overall have improved. We have much more work to do towards understanding gender constraints and barriers for women in India. In this case, one can say that prevention is the only cure. So do not waste this precious gift called life, as there's nothing greater than life itself. On that positive note, this is Lotty Alaric saying goodbye, and take very good care of yourselves and your partners.